Hello and welcome everybody. I hope you can hear me well. So I have the pleasure to welcome you to the ELF's European Patient Ambassador Program live session dedicated to advocacy. We still see some participants are joining. So I would kindly ask everybody to mute their mics when they enter the meeting, just for our program to run smoothly. And you're very welcome to introduce yourself in the chat, and we will all have time to exchange our views and to ask questions to each other later in the session. So let me go ahead and very quickly introduce some housekeeping rules. So as you see, we are running this session in the form of the meeting. So again, please keep your mics muted, especially while our speakers are giving their presentations. And we'll have a chance to chat during the Q&A. You can still interact during the session by using the chat function, the Q&A, or to raise your hand if there is a very urgent question while during the presentations. You're free to choose if you want to have your video on or off, but please take a note that this session is being recorded. So if you don't want to appear in the recording, please keep your camera off. Post-event, it will be possible to watch the recording. It will be available on the ELF website. So very quickly, I would like to give you an idea what is European Patient Ambassador Program, which is shortly will be abbreviated to EPAP further in this meeting. That's the program that European Lung Foundation created to empower the patients and to be able to represent their voice to health professionals, to researchers, and to policymakers to improve the patient outcomes and to be able to make changes in health policy, in healthcare systems, and it's a free online course that is available by the link e-learning EPAP Online EU. You see some languages that are available, but in the meantime, there are more European languages that you can follow the course in. It has different models, and one of them is dedicated to advocacy and how to interact with policymakers and how to make your opinion and voice heard. So you're very welcome to follow the course online. And we decided that it would be great to actually have a practical part of this course to be able in real time today to connect with our patient organization network and to be able to exchange experiences and to talk about real practices and real examples of advocacy actions and campaigns and initiatives that we are working on in our daily lives. And so we will first give a very short introduction of what ELF strives to do in its daily work. And then I'll pass the word to our panelists who will share their experiences. And then we will all have a chance to discuss and exchange our experiences. So actually, why ELF exists and why we invest into advocacy, like other efforts, it's because unfortunately, compared to many other health fields and disease areas, respiratory field is not always prioritized and gets the attention it deserves, maybe because it's such a broad field and we have so many conditions, so many diseases, but we would like to make sure that it gets appropriate attention at national and European level. And most importantly, to have the patient's voice heard, not only of health professionals, but most importantly, patients. And what we do, what ELF does, so we run our own patient network and we do our best to run advocacy actions with their participation. And today is a good example of how we create collaborations with other like-minded organizations and individuals to try to address common factors and common issues and problems to improve everybody's lung health and well-being. So some examples, I'd like to invite you how you can get involved with ELF advocacy activities. So one of the ways, and probably many of you are already engaged in one of our patient advisory groups. Another way is I'm very welcoming you to contact me if you have an interest in European politics and you have some particular issues that you would like to address on the EU level. We are always engaged in various consultation processes with European Commission, European Parliament, and we are always happy to represent your voice and to include your opinions in our contributions. Another way that we engage patients is giving you the floor to be at ELF and ERS advocacy events that are branded and organized by the group that is called European Lung Health Group, and we have some representatives here. It's a group of like-minded patient organizations and respiratory health organizations, and a dedicated group of members of the European Parliament who care about lung health and perform some activities to address this issue on the European level. And if you have any ideas of an issue that you would like to address in policy statement, a letter to a politician, to run a campaign, we're very, very happy to hear from you, your suggestions, your ideas, and implement it to our work plan. So without further ado, I would like to pass the floor to our speakers. And the first one is actually Dimitris Katipidis, who is ELF chair-elect. He was involved with ELF for already quite some years. Dimitris is our representative from Greece, who is a social entrepreneur and most importantly, a patient advocate. And today he will share a fantastic campaign for patients with cystic fibrosis that he ran in Greece, for which he was awarded with ELF Award in 2021. So I'm just gonna pass the floor to Dimitris. Please let me know if you need help sharing your slides.
Hello to everyone. Thank you very much for organizing this, Paula, for ELF, and I'm very happy to see a lot of people here and common faces from CF community also. And I will change a little bit the description. I will try to present you a real story what patients can do, and will be a floor to exchange opinions or to see what really patients can do when they are involved. Let me share my screen in order to gain some seconds. I will tell you that I'm from sunny Athens and from my second office, that is hospital. A lot of time the patient are used to work before COVID in different offices and to work digitally. And I think now you have, confirm me please that you can see it, and I will start the presentation.
Yes, we see it.
Okay, you can see it. As you obviously understand, my English are not so well, but I don't think that it's a barrier a lot of times to communicate. For this reason, I use a lot of time pictures of my personal album in order to communicate with you with a better way. So I want to prove you, to express that the patient voice can change things a lot of times, can create a national or international movement. And if we work together, we can have more results. So my focus is that the personal or individual emotions or actions can be a part of a bigger scale. So let me start. And I want to introduce who are the patient and how is the patient life when you have a chronic disease. So I will start my life journey and how a disease affects the life. So I have already tell you that I'm Dimitris Kondopidis, I'm 40 years old, and I'm patient with cystic fibrosis. What's wrong with that? With cystic fibrosis, it's hereditary disease and has low life expectancy. When I was born in 1982, the average of age was less than 20 years old. We didn't have medicine, and so it was very, very important to have access on medicine and treatment. So I don't know if you have children in adolescence, or if you have lived yourself a chronic disease that affects every moment of your life. In my adolescence, when I was 15 years old, I have a denial on anything. Why I have to study, why I have to go to university, why to give exams. When the life ends on 25, I didn't want to do anything. Thanks God, I had a good family doctor, and because I have lost my father in a young age, this doctor was more like a mentor, a coach, than a typical doctor that see the exams and tell you what medicine you have to take. So I went to the doctor and say, doctor, I don't want to do anything because the life, it starts very soon. And he told me, Dimitris, yes, you have right. The challenges to survive are very few and possibly you will die. But Dimitris, if everything go wrong and you survive, what you will do? What will be your profession? So please give the exam, study, and we will see together if shit happens, he told me, and you survive, what we will do then. So except from a good doctor that I have in my side, when you are living with a serious disease with low life expectancy, it's very important to have a extensive care to overcome these difficulties. And in these ages, in these years, there was no cure. We didn't have a lot of medicines, but I needed a strong medicine to keep me to survive. Can you imagine what this medicine could be? It's an open question to all of you. I will give you some seconds to think and imagine that it's a child in 18 years old. It fears very much the death, and he needs something to get hope. I will not let you more seconds. I will tell you the answer for my answer, at least. The best medicine in this occasion was Mykonos. I don't know if you know Mykonos. It's like a party island, like Ibiza of Spain. Mykonos is Ibiza of Greece. And as I was feeling that my life ends very quickly, and I don't have a lot of days in my life, I try to give value in my moments, in the few moments that I have. And I want to enjoy my life and my moments. So I went to Mykonos to work. Then I will start to traveling. Here is in Thailand, here is in Cuba. If you don't have go, it's very good opportunity to go. And I was trying to give value in my moments. Of course, I listen my doctor and make my studies. Until today, I'm studying because I like to learn things in this life journey that we have. I study graphic design, then I go to Spain in fine arts. My Spanish are better than my English. And I continue in architecture. Of course, together with my studies, I founded in 2016 a social entrepreneurship, but gradually I was losing my lungs. And in 2010, it started economic crisis in Greece. I don't know if you remember our Grexit things. And of course, I discovered that the lack of appropriate healthcare was the reason that we have lower life expectancy in Greece than other European countries. And then it starts questions. What you do to change these things? I will continue. If I continue to work and to study, I will die. So I decided to follow the advocacy journey. And I don't know how you do it and why it happened this, because when all your life is you are in the hospital, making a lot of intravenous therapies, when you lose your co-patient, I have a count that every month we were losing one patient in Greece. Here you can see 21 and 23 years old friends of me that we lost them. And when you lose your friends that you grow up together, you take it personally. What you do, it starts the battle for survival. Here is another friend of me, 18 years old, that she has made a lung transplantation in Austria. So how we start to fight? In Greece, we start like this, demonstration in streets. What we gain? Nothing. I can tell you that with this way of advocacy, we didn't manage to have nothing. I gradually understand the power of training. I went in European Patient Forum, some seminars, I understand the power of training as expert, as patient advocate. So after this, I understand the communication. It's a powerful tool that we can use. And as patient, we can go with cameras to make storytellings in the hospitals. After the communication tool, I understand that when we create empowered communities, we can have influence in the society that we work. Then I understand that we need a political intervention. And here you can see in national parliament, I make some interventions for oxygen, for reimbursement of oxygen tools. Then I understand it's not enough, the political intervention in Greece. Then I go political intervention in Europe. Here you can see me that I was candidate in European Parliament in election of 2016 for 15, if I remember well. So I tried to have intervention and influence in European level. It was not enough. You need international cooperations. Here you can see that we have a meeting with Mr. Bourlas of Pfizer, the period of COVID, through the Greek Patient Association that I'm vice president. Is enough? Not. We need more. We created collaborations with European associations. Here you can see the president of CF Europe. It's a great leader. And together with Hilde, that is the CEO of CF Europe, and the other members of European Family and Society, help us a lot to change the situation in Greece. It's not enough. Here you can see the president of Greek Democracy that has invited me as a vice president of Greek Patient Association in order to give some symbolism how the patient can influence the healthcare systems. So this was a description on how, as patient, then you jump to patient advocacy period and journey. And here I will say that I pass an activist journey that I don't feel that it's the better way. Why I tell you this? Because in 2019, in November 2019, it becomes the moment of truth. It comes the moment of truth in order to approve what a patient advocate or a patient advocacy system or association can do. What happened then? As you already know, lung transplantation is the solution of survival for CF patients. And unfortunately, in Greece, we didn't have lung transplantation. We have a collaboration in Austria, but in 2019, it stops the collaboration. So we have to save our patients that were 10 patients in critical condition waiting for lung transplantation. And among them, I was me waiting for 2 years for lung transplantation. And this was the situation, the difficult situation happening in 2019. Another thing that happened was in 2019, FDA approves not the cure, an innovation therapy that will freeze, entre comillas, that will freeze our disease. It approves a therapy that concerns 90% of the patients worldwide. It has high cost. The announcement was like a price, 300,000 euro per year per patient. So imagine that was some millions for reimbursement, and it's very difficult, these negotiations. And as I knew market access, how difficult it is to negotiate, I was sure that will take years to come to Greece. So the patient in critical condition that already described you, and the other patient were doomed. So what you do in this crisis, what you do as patient advocate, as a patient association. So my action was that when they called me in November of 2019 to make my lung transplantation in Austria, that was the final patient in the list, I denied it. And I denied it in public. We organized with our association a press conference. We invited the Ministry of Health, and we say that we want to bring the medicine. We want to start the negotiation for this medicine to have early access, and of course, to start immediately the lung transplantation. Because the statement that I was made this year was that I could not accept that patients will die because of bureaucratic procedures and financial priorities. So if exists a therapy, we want the therapy and we want it now. Of course, the results was not very good as I was expecting, because I was expecting, okay, the minister already came in this press conference, it make a public called to Vertex, was the company that has the medicine, and he told, let's start the negotiation. But the results was not so good. This happened in November, but in January and February, we lose 18 and 35 years old patient that was among these patients in critical situation. So we start to think that it's not so easy to make a campaign or a statement. Then it becomes the COVID. As you remember, everybody was closed in our houses. It was the most difficult moment to make a reimbursement in so high cost therapy when all the healthcare system has to face COVID. And I have a crisis, a personal crisis with a port that I have in my chest. So I thought that everything will end. So what we do then, I start with my patients and with the association to make a campaign from the hospital as the final fight, before you die. I don't want to tell you more because it's an interesting story. It's a big story. I want to say that with this campaign that we do it and influence all the topic society, we have a big support from CF Europe, a big support for every stakeholder that all of this year we have made connection and established collaboration. We did it, and we take early access. The 30 patients that was in critical condition, they take early access before the reimbursement. And today, all the patients in Greece have the appropriate therapy. And I think this was the reason that ELF honored me with an award, because I make the best I could do as patient advocate in order to bring the therapy. This is considered an heroic act because it has the result of saving patients. And I will tell you now that the lessons that we learn is that it's not the activist way, at least for my opinion, it's not the better way. I think we have to follow a patient leadership way and not an activist way. So I believe that heroism and activism, it's a wrong approach. Why? Because we don't want hero patients. The patient have the disease to fight. It's a big price if you add on your difficulties of your disease. We have to fight in all of these situations. And when you are hero, you have to sacrifice. You have to sacrifice your personal time, your personal future, your families, your friends, and it's a lot of pain. And of course, if you die or if you don't manage it, there is no containability. There is no sustainability in the ecosystem of patient advocates. Instead of heroism and activism, I believe that we need systemic solution that will protect the weakest. We have measurement tools like HTA, and we can see what is the value of a medicine and what will be the price that it's fair to reimbursement. And of course, we have to focus in evidence to have a value-based healthcare systems. We have now real-world data, and if we take a lot of real-world evidence, then we can make politics with measurement tools, with evidence-based. So my belief is that I want to share with you that I think we need patient leadership instead of patient activism. So we have to create these leaders, because leader, you are not born, but you can become a leader when we train you. So we need to focus on the mindset and the skills of patient advocates and leaders to be ethic and to have a courage in all these difficult ecosystems and challenges. Secondly, we have to educate them how to make influence with empowered communities and partnerships in a national and international level. And of course, to focus, to give them experience, knowledge, information, data. So if I want to tell you 5 things to keep notes from this presentation for this journey of a patient, is that first of all, we have to create a strategy in every challenge that we have to face. We can make SWOT analysis, PESTEN analysis, and to make a strategy, not to do things without know why we do and what we want to gain for this strategy. Of course, we need to create partnerships in a level of trust, national and international level, and trust during the years. We have to to think that it's a marathon. I tell it after it. Of course, we need to empower the communities, even if they are patients, if they are the parents, the carriers, or the doctors. So we have to work all together. Of course, the media have a big impact. Patients already have impact, and if you do it in appropriate way, we can take a lot of this. And definitely, when you make a strategy, we have to consider the next day. It's not a fight that will start with end. It's a battle. It's a marathon that we have to have sustainability and to be careful what we want to gain and what will be the next day. So if you make this preparation that the other speakers after me, I think they give you more certain tools, you have to dare to take action in order to achieve something that everybody know, to have more healthcare, more justice in healthcare, and to take advantage of the little researches that we have in health, to take the benefits in cross-border healthcare. So that was my presentation. I think patients have followed the leadership's way, and this is that I'm doing here in Greece through the Patients Hub and my master in leadership, innovation and value in care that I now am finishing. So that's from my part in Greece. I hope the time was not okay.
Thank you so much, Dimitris. It's a fantastic, inspiring story, and we appreciate that you openly shared the challenges that you faced and what worked and what didn't work, and that you at least managed to reflect on it and put it as a lessons learned. So if you have questions to Dimitris, please put them in the chat or keep them until the Q&A session. He'll be happy to tell you more about the campaign he conducted. But at the moment, I would like to pass the floor to Sophie Peru, who is EU Policy Coordinator at the Health and Environment Alliance, who's in charge of contributing to decision-making process of the EU institutions, and she's focusing mostly on environmental health, access to healthcare, food safety, social affairs. She has previously experienced for more than 5 years as advisor and campaigner in the European Parliament. So I think she can share experiences both from perspective on NGO and from perspective of European institutions. And she will share with us how to run a European advocacy campaign and make a real impact. So please, the floor is yours.
Thank you so much, and hello everybody. I'm Sophie. Indeed, it's very difficult to speak after you, Dimitris, because you said a lot already. I just want to say before I start that I come from the Access to Medicines community, and now I really entered the environmental health community. The two are very linked, and I will try to show that to you in my presentation. So first of all, before I really go into this, normally you should see it this way, yes. What is HEAL? So Health and Environment Alliance, we are an NGO, and we are very, very proud to have in our network ELF. So basically whatever I'm going to tell you is actually, talking about whoever is in the ELF membership. So that's very important that you have that in the back of your mind. And we are we are a non-for-profit organization based in Brussels. We have about 90 members for all across Europe beyond the European Union, and it's a very broad community. So some of our members are patient organizations, others are doctor organizations, others are researchers, others are healthcare payers. We also have environmental groups. So this is a broad community. And what I want to show to you is that you are actually already embarked on an EU advocacy level big campaign, and I will show it to you, and I will also try to show you how you can individualize it where you are. So what it is about something that we've been waiting for years. It's the revision of the legislation at the EU level of the ambient air quality. So this is a very, very important piece of legislation for everybody living in Europe, but also beyond, because it's basically sets limit values for concentrations of pollutants in the air. And we all know in this group here how air pollution is a key factor for respiratory health. So this is something that we've been calling for years, so that the current directive that is currently applied throughout the European Union, is from 2009. So it's very old actually, and it's based on outdated science. So where are we, and what are we doing, and what are we trying to do? So basically, when the last EU election happened, so that was in 2019, there was something completely new on the EU level, and it was called the European Green Deal. I'm sure you have heard about it. If not, I can tell you later. But anyway, one important piece in this was that the European Commission was committing to change the legislation on air and to actually update it so that it's more closely aligned with the latest science, actually with the WHO guidelines. So we said, okay, we really push for this, and we really, really want to have the best out of it. So we are in that journey right now as we speak. And about air pollution, very importantly, I think it's important that you know that air pollution is the first environmental threat to health. So it's really important that we tackle this properly. And when we talk about air pollution, we talk about sources of air pollution, of course. So we need to know that it comes a lot from fossil fuel burning, and that then when you have the burning, you have particulate matter. That's one of the biggest challenges for health, the biggest health threats. And that is having a lot of impacts on our health. That's PM 2.5, PM 10, and also smaller levels. And the key message I want to convey to you, you may be patient, but so you need to know that everybody is a potential patient when it comes to air pollution, because everybody is vulnerable to the impacts of air pollution, and it depends on your age. Sometimes it depends on your background, on your, let's say, health condition, but it also depends very much on your social conditions as well. So it's all very, very linked, and this vulnerability can change throughout our lives. So we are all vulnerable to this. And some of us are more at risk than others, especially when you are already facing some challenges, some health challenges. So what do we want to do? And this is the key message. If we want to have an impact, we need to have a clear goal. And the clear goal we have with this legislation, we want to change it so it's science-based. Science is our guiding star in this. So science, we see the WHO being really the golden standard for this. And we have a very, very simple ask for the European Union. We want that the European Union aligns its air quality standards with the guidelines of the WHO, and those were revised very recently in 2021, while the previous ones were from 2005, so very old already. So what did we do? We basically started with a position paper. I'm very sorry, it's not something that everybody thinks is activist or whatever, but actually a position paper is super, super important because you need to know what you're asking for. So we developed together with our members, we developed a 10 demands paper. So, and we really developed a strategy. So what we want by 2030. So we want full alignment with the WHO guidelines by 2030. And it's a document that is available on our website and with different languages, versions, and we really spread it to the policymakers. So it's very important to convey your message directly to the policymakers in an easy to understand way. 1 year after that, after the WHO released their new guidelines, we expanded the group. And so my presentation is about the power of the network. We need leaderships, but we also need a very well-structured network. And a network can be just one person in every place. It's very important to know that a network, everybody is welcome in the network. And so what we did, and ELF was one of the co-signatories of this, we wrote to the policymakers who were developing the new legislation. We wrote to the Commission, and we did it with a whole big group of organizations. So actually more than 100 organizations joined us, and Isabel, who is the next speaker after me, is also from an organization that also joined this. So basically to show the power of the unity and to show that we are cross-border, that we are big, and that we are vibrantly vocal, and that we know what we want. So a few months actually after this, 1 month after our big call, the Commission, we can even say, responded to our calls by proposing a new legislation. One has to really understand that this is not a given at all. So when you want to have a new legislation, you need to ask for it. You need to be super annoying to the Commission so that really, really hear you. And so we brought people to the Commission to talk to the Commission and say, this is what we want. So we ended up with having a proposal from the European Commission. I don't know if everybody knows very well how the process is, but basically the Commission proposes something, but then the European Parliament on one hand and the European Council, so the member states, they then have their own position, and then they start negotiating together. And when they agree, this becomes the new legislation. Were we happy with what the Commission proposed? The answer is not exactly, because they did not propose what we wanted. They proposed to align with outdated science. And we said, no, that's not good enough. We want more. So what we did, we also really amplified the voices of patients, but also of doctors, and we tried to convey them together. So this is just one example, but we have many more of a doctor and who's representing the whole community of the European doctors. And he said very clearly that basically we need to do more than what the Commission is proposing. So this was very, very powerful. And this quote was actually taken up by The Guardian afterwards. So it's important to prepare the communication very easily and very very clearly, so that journalists can really use it when it comes to it. So that's also Anna from my organization, from HEAL, who said that basically the Commission shied away from proposing what is needed, and now it's for the co-legislators to change it. And we are all very legitimate to talk to them, especially the European Parliament. Everybody is, and I mean, the members of the European Parliament are directly elected by the European citizens, and the member states were also very legitimate to talk to them because they represent us ultimately. So I will try to shorten it, because otherwise I could talk about it forever. But basically what happened is we pushed our messages, we developed them very strongly and very clearly and very in details, because we are, in Brussels, we are representing a broad community, and we have some experts on how to do the advocacy part. So we tried to do our best here, and we ended up having a first draft of a draft position of the European Parliament. And this is a very important document now. That is, so basically the beginning of the construction of the position of the Parliament. That is very much echoing our demands. So I will not go into the details, but one thing to remember, the person, the MEP, the member of the European Parliament from Spain here, who is going to be the negotiator for the Parliament on this very, very important file, he really answered our calls on a full alignment and also on other things. So this is a very, very promising start. And I think this is important that you are aware of it, because it's really directly addressed also to you. So does the journey end here? Not, of course it does not. And before I get into the next steps, I want to show you this. This is a non-very sexy slide from the European Parliament. This is how it looks. So what it is basically on the European Parliament's website, you have a lot of things, but you also have access to every file the Parliament is working on. And so here for this file, it has a number, a procedure file whatsoever. We can see if the MEPs are willing to be transparent, they show who they spoke to. And you know what? Normally, when a patient organization comes to an MEP, the MEP wants to show they're listening to them. So they would be very willing to show that they have met with you. And basically, we organized a whole meeting with the rapporteur of the European Parliament, so the guy who wrote this. And we organized a meeting from the whole health groups that we could gather that are based in Brussels at EU level, to go to meet with him and to say, well, this is what we're asking you to do. And so this is very, very important to have direct contact, because the impact is actually there. So I really strongly encourage you to have this in the back of your mind, to have direct contact. There are next steps. First next step, which is not next, but from last week, there was already a debate, and you can watch it if you want. You can see what was said in that debate. It's all public on this file in the Environment Committee in the European Parliament. This is the first step of the legislative process in the European Parliament. Today, an hour ago, MEPs had a deadline to table amendments to the Commission's proposal to complement what the rapporteur Javi Lopez did. From today on, we are not able to follow very transparently what is happening in the Parliament, because it's happening behind closed doors. They're negotiating among themselves on what they have amended. And we really hope, and we really tried our best to help them to table right amendments that are protective for vulnerable groups and especially for patients. They will then ultimately come to a vote. So two key votes, two key moments, and a third one, and this is directly for your own strategies. So please note it down, so that on the 26th or the 27th of June, we don't know yet exactly when, the Parliament is supposed to have a big vote on the Environment Committee on this file. So this will be very important, and this will be very important that we influence this vote so that the best text is adopted, the best health protective text is adopted. And after that, there will be a plenary vote. A plenary is when the whole Parliament comes together and they vote together, and then they adopt the position of the European Parliament. And then they're ready to go to negotiate with our member states, with our governments. And one key date, it's the next EU elections. And you are not only patients, you are also voters. And people know that, and they need to really be clear about that you can influence the voting, your own vote, but also people around you. So they really listen. The other co-legislators, so you have the European Parliament on one hand, then you have the member states. The member states are together in so-called Council of the European Union, and you have so an Environment Council where you have all the environment ministers who come together, because for a very strange reason, let's say currently this file on air pollution is not being dealt with by the health ministers, but by the environment ministers. And here it's a black box. We don't know exactly what they're doing. The negotiations are completely behind closed doors. It's very difficult to track. While for the Parliament, we can see who tabled what amendment. For the Council, it's not the case. So here, I'm actually asking for your help to embark on this journey, because we actually need to influence in every member state, and there is no small advocacy step. Every advocacy step counts. This is very key. So on this, just to give you one example of what an advocacy step can be, when we know there is going to be a debate or a decision that is going to be taken, we want to influence it. So we need to give a signal, a political signal, to say, hello, us as a community caring for this or that, hello, you the political, you the policymaker, we are asking you this, and you need to be very clear on your demands. What we do as HEAL, we draft template letters, and then we actually propose to our partners, to our members, to co-sign with us. And we also propose, so that's for the EU level, and then for national level, we very often draft template letters that we propose to our partners and members on the national level, and they can translate, they can adapt, and they can send it. And just one person in one member state can do miracles, because we just need that letter to be sent. So finally, and I will end up with that, we also have something that is very easy to engage on, and you are all very welcome to join this. We have a petition that is running to ask for clean air. And we are now developing the strategy on how we will hand this over to the policymakers. So basically, to give you an idea of who, so we have more and more organizations that are joining us on this. So this is very open. So if you want to join, please let us know. We can add your logo to this, and we want to amplify it, and we have it in different languages. So here you see all the languages we have. We have Bulgarian, Czech, German, Spanish, French, Italian, Dutch, Polish, Portuguese, and Slovene for the moment. But yeah, if you want to join and amplify this, we will see how we can accommodate maybe more. I don't promise, but at least we can really try. And just to end my presentation with this, whatever you do, there is no small step, but please remember that the power of the network is also your safety net. We don't want all to be burnt out by the advocacy we're trying to do. So we all need to be very connected. And so I have 3 key messages to end this. Whatever you do, be proud of what you're doing. Don't ask for the permission. You're totally legitimate to ask for what you're asking. Secondly, be connected. That's very key. And thirdly, be strategic. And the 2 are coming together, because sometimes we want to do something and it's going to end up being too time consuming, so we don't do it. But we have a strategy and we try to stick to it. Thank you.
Thank you so much, Sophie, for guiding us through this whole EU legislation process, this important file. Yeah, equality is a very important topic, especially for respiratory community. And thanks a lot for giving this opportunities how to get involved for everybody who's in the meeting. So I shared the link to the petition, and I think Sophie maybe will share her contact information if somebody wants to contribute with a logo of the organization or get further involved. And now I would like to pass the word to Isabel Proano, who is actually the Deputy Director at the European Federation of Allergy and Airway Diseases Patient Association. I hope I said it correctly, and EPAP board member. And she has fantastic experience in policy and communications towards European institutions, WHO. And I'm personally looking forward to hear her tips and tricks and do's and don'ts and all the experiences working with policymakers. So Isabel, the floor is yours.
Thank you very much, Paulina.
Slides in a second.
Okay, I'm online?
Yes, we can hear you well.
Okay. Thank you for the short introduction. Also, it's grateful to see everybody of you in the call today, many familiar faces. And also thank you to my co-speakers, Sophie and Dimitris. Dimitris, it's great to see your energy. So thanks for sharing your experience. Just for you to know, I'm not a patient, or at least not a patient with respiratory disease. I am a professional patient advocate. I've been working for EFA with some of you at national level also for almost 10 years now. So I'm really happy to share some of our learnings. Can we move to the next slide, which is the only one that I have? I want to just make it clear also for you, because I wanted to share with you some of the learnings and examples. I'm going to speed up with a summary of a methodology that you see on the slide on how to run a campaign, such as the ones Dimitris and Sophie have presented. So let's start with the first tip, which is define your campaign goal. So you are part of a patient organization for a reason. You decided to create it or you decided to belong to it, and that's your broader objective. Now, in the time that we are living on, you need to decide the one thing that will make the most impact in your community and that you want to invest your own organization on. That is already a process on itself. I'm not going to enter into it. For Dimitris, it was access to a medicine. For Sophie, it is an air quality law. So once you have defined that as a short or long term, as an organization mission or as a project, you need to identify who can help you. And all these steps, they include already thinking about talking to an MEP or to a Ministry of Health, but you need to think about it before going to talk to them. The second thing is to choose your partners, who are your influencers. I have witnessed that the power of patient organizations and our voice is very impactful in politics. We are, as Sophie was saying, we are also the electorate base, and that is very specific when you are close to the election cycle. There, everybody wants to listen to the patients. However, we're just a piece in the process and we need help. And as Dimitris was saying, we cannot be the activists because we have a disease to carry or someone to care for. So we need to choose really our allies. You need to choose your partners who can be your ally, coordinate with them and shape the message together, influence together. you can choose, you know, at a national level, but just let me give you a very short list. Foundations, public health organizations, human rights and social rights organizations, and of course, when you are a patient, your doctor, your medical society. Why all that? Well, it's a question of resources, of complementarity. We cannot afford, as Sophie was saying, and I know we're doing this on the air quality directives, we cannot afford to have a policymaker that receives options from health stakeholders. There is no option. We cannot discard each other. We cannot propose different solutions. There must be at least the main ask that reflects what we want all the policymakers to enact. And that ask needs to be clearly spelled out, agreed, and strongly carried by all stakeholders everywhere. Then each organization might have a complement to add to that ask. And that is totally fine and welcome, but we need to be looking together. So for that partnership building, you need to be transparent, treat all members equally, and inform each other regularly. As an example, at EPA, together with ELF and together with other patient groups of whom you are belonging to, we launched the European Lung Health Group, which is informal, with a vision, a paper, like Sophie was saying, with a vision for 2030. It's called the Breathe Vision. And one thing that we did, it was, okay, we want action at EU level. And we looked at what was going on and we saw, okay, there is nobody that we can clearly talk to. There is nobody looking at or clearly saying that they are looking at non-communicable disease, many of the chronic diseases on respiratory and on respiratory. So we organized all together 9 organizations, a meeting with a director in the GESANTE, which is like the Ministry of Health of the Commission, asking him to appoint somewhere in the organigram someone who would be talking about chronic disease and respiratory disease. And he did. And that has been a start for many, many things. So sometimes you really need to narrow what you are asking and do it together. Now, the third tip is, okay, so how are we going to, you knew that you had to go to this direction, but how do I choose my target? Well, fortunately or unfortunately, health is not property of the Ministry of Health. There are many actors involved in health prevention and care and the delivery of health. And as most changes required by patients' organizations are systemic, so they affect the healthcare system, and even sometimes they affect the right to health that is granted by a state, you need to be specific as possible with the change you want. Whether you are asking for access to a medicine like Dimitrios or multidisciplinary care like the patients that live with chronic obstructive pulmonary disease, or a disability scheme or tobacco law, you need to identify what is the governance level. I am going to the national, I am going to the regional or to the local, and then also see who has the power to change things at these different levels. So some tips for that. Set up the problem and propose solutions, provide as many numbers as you can, the science, and the human story behind those numbers, what Dimitris has shown us today, the pictures. If you don't have the relevant data, then your ask is for the public administration to generate that data, because you have a situation and your patients do, and you are bringing that voice. You have to address them all. Contact the Medicines Agency, the Ministry of Health, the Social Security Institute, the Ministry of Finance, and by the way, contact all political parties, because health is apolitical. Do not politicize it by choosing who to contact. Contact them all and contact them for a meeting. If they accept, organize a meeting that is short, that is clear, rehearse for the meeting, go all together to that meeting and check on the progress every 6 months, because the administration is a slow animal. So every 6 months is enough. If the meeting has been declined, then you need to go to the press. They will voice the issues for you. They are really looking for those things, especially if that is election time. We have an example at IFA, and this is a learning for 20 years, we were targeting the one directorate in the commission, the one for environment, asking them to improve pollen monitoring, the monitoring of pollen so that allergic patients could see what was going on in the air. And for 20 years, they were saying, oh, we are so sorry. You're asking us to regulate the nature. We cannot do that. So we looked at ourselves, partnered with a law firm, conducted a study of where pollen could be included into law, and it came out that it was more maybe linked to climate change. So we have started it since 2020, going and targeting the climate directorate at the commission. And right now, although it's not a law, we have an observatory that is creating and studying what is the impact of climate change on pollen and the impact of pollen on health. So little by little, we are creating evidence there. As you've seen, we had to a bit change the targets, and that made also our narrative evolve, which is the fourth tip: shape your message. It is very rare that your message will be immediately taken on board. My experience is that you need to wait around 5 years to see any positive movement into the direction that you are targeting. And that requires that for 5 years, you maintain your position and you voice it and you bring it with the partners. But your message can evolve and it can be underpinned by new data. You might choose to link it to the local agenda. You might choose to change. There is COVID. Well, that maybe is where your intervention can really be looked. So there is non-negligible power on being ready. I don't think it is, I am unsuccessful. No, I'm ready to jump at any occasion that comes up. I have an example here, but I'm going to pass. I'm conscious of the time. So I'm going to go to the last thing. But how do I do this? What is my action? Well, what is your methodology? It's very simple and it's not fancy. You need to repeat yourself in a letter, in a meeting, in a coffee break, in your social media, in your network. A public administration that works well needs to keep track of interactions and recommendations. They are bureaucratic. So your issues, if you share them officially, are stored somewhere. Every time you bring them up, you are making your target accountable. So your methodology is clear. Repeat the problem, repeat the solution, ask for feedback. Where is my file? Where is my medicine? Where is my air quality monitoring? Your voice and your time is your only instrument. You know it. We are volunteers. Then something will happen, maybe, and you don't know who did it, but you know it came from you. You don't know who did it. And this is an example we have at EPA with the latest regulation proposal for a regulation on digital health. Suddenly you have the Commissioner for Health talking about digital data and the risk of anaphylaxis with its an allergy, and then how you can move your CT scan results for the lung from country to country. It has a perfume of a patient having been hurt, but we cannot say who made it. Anyway, last thing, I know there is a lot to do, but please always don't be stuck by the method. Start somewhere, start walking, it will lead you somewhere and it will make you learn. So that's my presentation. Thank you.
Thank you so much, Isabel, for sharing this step-by-step map on how to reach the policymakers and addressing different challenges and scenarios, and how to face them and how to go through them. And I think this presentation is a very good transition to our interactive part. So now if you have questions to Sophie, Isabel, Dimitris, our speakers, please feel free to raise your hand and to ask them or to write them in the chat. And be happy to hear your opinions and to answer your questions. I saw there was one question to Dimitris about the ways of funding advocacy activities. Do you have any experiences that you could share with the audience, Dimitris?
Yes, it's a very good question, and I think it's not enough time to to explain here, but the main difficulties that faces the patient advocates as persons or the association is the funding. Who will fund these actions? In my case, I have my house, so I didn't have to pay my house, and I have some incomes that gives me the opportunity to focus on this. But of course, this is not a sustainable way, and this is not that everybody can do it. So when you are in the patient advocacy, ecosystem, you have to find funding channels. A lot of times it is an association. A lot of times the association doesn't have a lot of money. And I think the two key points are, first of all, you need to find the appropriate vehicles or the channels of funding or organization, like foundation, like all of these things that we are doing together, and to be experts on funding, to find in professional way funding. And the other thing is that the volunteers, it's a big treasure that they can give in kind or in time or information free. But you have to set up channels that you will take this value. If you are not organized what you want from the volunteers, you cannot take the opportunity. Of course, in the communities, you will have lawyers that in the family members, or some doctors, or some, how we say, from the press, journalists. So in the communities, you will have a lot of persons that can help. The thing that we have to do is to set up a system that you will use them in your scope. So this is the two main ways to fund your actions. But it's very difficult session that we need to focus on that. It's a fundraising methodology, for example, in NGO or patient associations.
Thank you. We have one more question that I'll pose to Sophie and to Isabel. So beyond seeing large achievements like policy change, like yes, we are aiming to change the equality legislation, for example, how else can we measure the impact success of our advocacy campaigns? Like Isabel mentioned that you cannot always know that the change is coming directly from you, but how can we assess ourselves how we did on the campaign?
Okay, thanks for the question. That's a very good question. We try to keep track of it, and it's not always easy for us. You can just see that if policymakers are talking about what you are talking yourself, you already succeeded. That's the very first level. Then there are many other levels. For example, in our case, we very clearly see when an amendment, for example, or a wording in the legislation is in line or is not in line with what we've been asking. So that's very easy to track. But I guess sometimes it's difficult to track, but that's not a reason for not trying. And I really want to emphasize what Isabel said, keep repeating the same message. This is key. This is key. It can take years, but at the end, something happens. And as Isabel was also saying, be ready, because you never know what the next opportunity is going to be. And we did not imagine that the Green Deal would happen, but then it happened, and then we had to jump on it super quickly. And that's just because we were ready with the community, with our messaging.
Yes, can I add something to that? Of course, there are technical ways to measure. You have the qualitative and the quantitative. The quantitative is how many people are engaging with you, for example, on your social media, on your letters, how the indicators to how many MEPs have you met, how many have received your letter, and then is the change. But the change, sometimes we need to be humble, because there are things that can happen in 2 months and then others that can happen in 2 years or 20 or not at all. So there is, I think, the learning process that is something that sometimes we neglect. How did we learn to get more efficiently access to an MEP, to the ones that can change? We are starting also to track that at EPAP, because it's important, because that explains how you are moving around on this environment. And at the end, policy change usually involves law and regulation. So it is going to take time. I'm telling you, for me, what I see is 5 years minimum.
Thank you. And I'm conscious that we are running out of time, but there's one more question in the chat that I'd like to pose to all speakers. What has been your experience of bringing different national organizations together for a shared campaign when people have different agendas, different priorities, different political systems?
I can maybe respond already to this. The experience is amazing. I mean, you should not underestimate the power of being orchestrated across countries, and our experience has been just marvelous on this. So of course everyone has different priorities, but the moment you come with one key thing, one key message at one key moment, you can have a huge impact. And there's a lot more to come on that aspect, actually, on air pollution.
You're muted, Paulina.
Sorry, thank you, Isabel. So if you have no more questions, I'll just quickly maybe pass the floor to each of you for one key last maybe takeaway message, or what was your reflection from this session for our patients to take away from this session.
What I have seen is that if you feel something needs to be done and you don't see it happening, do it. Do it yourself.
So I see you nodding. So I think it's important yet to see where there are the gaps and where there is nothing yet done, and just to be brave and to jump on those opportunities. Dimitris, do you have a closing word for our participants?
You know, in the business, a lot of times we say that when you don't have the money to pay a star, a good player, maybe you can create estrellas, to take estrellas, a lot of small stars that if they join together, they can make the Big Bang star. So I think in this ecosystem that is grassroots movements, that we have the vision and the passion to do it. If we use some tools, technical tools, and if we exchange knowledge together, we can make this difference. So just there, make collaboration, and let's be the little pieces of the big puzzle. We have a lot of power, and we can use it because it's a common goal, and it's a fair goal to have more health for all, using the power of each one. So that's my message. And thank you for the great presentations with tips, and we need to repeat it. Paula, you can organize another like one.
Definitely. I think by coming to the closing point, I'd like to thank Sophie, Isabel, Dimitris for fantastic presentations, and I'm sure there are a lot of takeaways for our participants, for patient organizations, and everybody who followed, who is interested in advocacy. So this is a series of sessions of EPAP program. Stay tuned for new announcements, and I hope, as I think the main message was how important collaboration is actually in advocacy activities. So let's just stay in touch, and let's move ahead the healthcare systems and the policies together for better health and better well-being of everybody. So I'm wishing you a lovely continuation of your day, a lovely lunch break maybe, or just go ahead with your day, and hope to see you very soon at our upcoming events. Thank you again to our speakers, and have a lovely day.
Ciao.